Are you finding any resistance still in people accepting it? Or, I mean, I know it's a long journey. I was speaking to an IPS officer this week, and she said that someone asked her, did you ever have any kind of mental health counseling? And she said, no, we just kind of relied on our, brotherhood at work or sisterhood at work. They didn't have anything formal at the time. But do you have cops, for example, saying that we're too busy to do all of this?
Well, yes and no. So there are certain organizations that are extremely open to it. For example, the CISF. They've been very open, and they've been actually wanting, to embed mental health programs into their system, because I think they've seen, they have evidence. They've seen how it has worked. Not only has it reduced, say, the rate of suicide, but it's also increased, social interactions. It's reduced loneliness. I think just knowing that there is support for them has really enhanced their working. So things like that have really worked for them. So there are certain organizations that are really open. So there are people who are definitely asking for it.
That's really heartening to know. That's really heartening.
It is because, also traditionally men are supposed to be, the sex that doesn't ask for help. So having this kind of preventive service in something like a security force is really heartening.
Share with us other such anecdotes, because all of this makes it so real for us, to really get an insight into what's happening on ground and how people are embracing the change.
So even I think in colleges, for example, with the youth, I think, there are a lot of colleges who are part of the COPE program. And I think generally youth by and large are far more open to it. They are open to acknowledging what they're going through. And then they're also open to seeking help. In fact, very often we have, in some of our college cells, we have our clients, the children who come and tell us that, who share very openly that they want to seek help, but the parents are not open to it. Or the parents don't want them to seek help. And the parents want that they should just somehow cope with it. So there are very often where they come and they don't want us to tell their parents because they're scared that they're going to stop that.
It's just...
that's where the silence is still there. That's where the stigma is still there. So it's a long journey, and I think, trying to bring about any kind of paradigm shift does take time. I do believe that, it's the second generation after us. So which means my children's children who will really benefit the most, because I think the next generation will, have a much different outset and mindset when they're raising their children.
And when you've been on this journey, has it also shaped your own sense of vulnerability, emotional strength? Because you must have had to see so many people going through various things, even if it's through your team and what you're hearing and what you're seeing on ground. But it must have changed your perspective.
Definitely. It definitely builds resilience. I mean, because there are some stories that are really sad. And, there are times when our teams have had to deal with, cases of suicide also. That is very sad, but it also helps you become more resilient. It increases your own vulnerability because you realize that, you're as vulnerable as anybody else. But it also strengthens the resolve to do more of what you're doing.
If you like the video, do like, comment, share and subscribe.